Ma'am, shall we start? Jaya ma'am?
Yes, yes.
Thank you, ma'am. Good evening, everyone. All of us are put in boxes by our family, by our religion, by our society, our moment in history, even our own bodies. Some people have the courage to break free. Warm welcome to the webinar on International Transgender Day of Visibility. Rachel Crandall, a US-based transgender activist, founded this day in 2009 to raise awareness for the incredible burden of discrimination of the community faces in every setting imaginable. The need to bring a day of visibility for the transgender community is indicative of the oppression they face in many sectors of life. March 31st is the International Transgender Day of Visibility, a day to celebrate and honor transgender people and increase visibility and awareness of the transgender community's struggles and triumphs. Transgender movements have been increasing over the past few generations because of the biases that some people would assume about the transgender community. This day focuses on more of the positive aspects of what being transgender means and takes direct action in changing the biases of the people who don't understand transgender. Transgender people have historically been marginalized and excluded from the mainstream society, often facing discrimination, harassment, and violence. Transphobia and discrimination are still widespread, and many transgender individuals face significant barriers to accessing healthcare, employment, housing, and other necessities. So we are here to listen to the expert via webinar today. So let us formally inaugurate the event by lighting the lamp and invoking God's blessings. I invite all the dignitaries present over here to kindly join hands to kindle the lamp. Thank you all. May I now invite Professor Smriti Arora to welcome the guests of the day and all others present virtually and physically. Please, ma'am.
A very good afternoon to all of you. Dear friends, today we have gathered here to celebrate International Transgender Day of Visibility. I heartily welcome Director Ma'am for her constant support and approval for the program, though Ma'am is not there, but her blessings are always with us. I welcome Dean Madam Professor Jaya Chaturvedi for her gracious presence and giving us the permission to conduct this program. I welcome the chief guest of the day, Dr. Aqsa Shaikh, and I'm eagerly looking forward to hear from you, ma'am. We also have the members of Sangth team, Mr. Sharin, Gaurav, and Salik. We welcome you all. I welcome the organizing secretary of the program, Dr. Raja Rajeshwari, all the faculty members, tutors, and dear students. Friends, you must be wondering how I met Dr. Aqsa Shaikh. So I met her on Twitter and I followed her. Madam is currently working in Jamia Hamdard, though I also have worked there, but I never got the opportunity to meet her. And I hope we will meet in person soon. So when I came to know about this International Day of Visibility for Transgender, I thought ma'am is going to be the best person to speak on this topic. Thank you so much, ma'am, for accepting our request and taking a session during these holy days of Ramadan and during fasting. Though many movies are being made and the social media is very active related to this issue, but still as a general public, we have a lot of myths and misconceptions. Transgenders, they face a lot of problem, whether it is physical abuse, mental abuse, verbal abuse, or not giving them the equal rights as other genders. So hope that through this webinar, you all will gain new insights related to the issues of transgenders. Once again, we welcome you all. Thank you.
Thank you so much, ma'am. Dean Academics Professor Jaya Chaturvedi is with us, joined online, and I welcome ma'am to kindly address the group. Please, ma'am.
Hello. Good evening, everyone. It's my proud privilege to attend this transgender issue addressing webinar today. Along with you all, I welcome the guest speaker and all other dignitaries for this webinar. And as we know, I'm an obstetrician. When the child is born with the abnormal gender, what happens, what is the reaction of the parents, and later on, whatever the problems they are facing in the community, the discrimination in the educational setup and workplace, social exclusion and homelessness, then psychological stress on them. So everything, I think they are daily facing, and we are, means not everyone, but the community is not soft towards them. So all these things to be taken as issue, and we should solve this problem, because now the government is also accepting in the forms we are filling that either male or female or other gender. So what is the mean of other gender? This is transgender. So when we are accepting them in the forms also, so we should accept them totally, means never discriminate them totally in our society. And that is the purpose of this webinar. And we will accept a few very good things from our guest speaker, and we will take home good messages. Thank you so much.
Thank you, ma'am. Recognizing the International Transgender Day of Visibility is critical in combating this discrimination and raising awareness of the challenges faced by the transgender people. So we must create spaces for transgender individuals to share their stories and experiences, to be seen, heard, and respected. Visibility is essential because it helps to reduce the stigma and misunderstandings surrounding the transgender persons. It also helps to highlight the diversity within the transgender community. Supporting and learning from trans people is essential in fostering an inclusive and compassionate world. Members and allies of the trans community recognize the unique struggles and challenges that trans individuals currently face, that is discrimination, marginalization, and dangerous legislation. They have made significant contribution in many fields, including art, science, sports, public service, activism, and more. One such notable personality is the chief guest for the day, Dr. Aqsa Shaikh. By actively supporting and learning from trans activists and leaders, we can better understand these challenges and work together to create an environment where everyone is treated with respect and dignity, regardless of their gender identity. Dr. Aqsa Shaikh is an out and proud trans woman. She is the one of India's first transgender doctor. He is an associate professor of community medicine, nodal officer for COVID vaccination center, Hamdard Institute of Medical Sciences and Research, Jamia Hamdard, Delhi. Dr. Aqsa is an academician and a researcher. She is part of I Hear initiative at Sangth in India, which undertakes research and project implementation for inclusion of transgender and disability community in healthcare sector. Founder Director of Human Solidarity Foundation, Dr. Aqsa is a vocal advocate for rights-based gender justice for transgender persons, persons with disability, and persons with mental illnesses. Dr. Aqsa successfully petitioned Delhi Commission for Protection of Child Rights to pass orders on banning unnecessary sex normalizing surgeries on intersex children. She also serves as section editor of PLOS Global Public Health. Welcome, ma'am, and over to you.
Thank you very much. It's indeed a pleasure to be with all of you today on this very important day. I hope I'm clearly audible. Kindly let me know if that's not the case. I'll share the screen so that the PowerPoint.
Please continue.
Can someone please confirm if the slides are visible?
Yes, ma'am. Slides are visible. Please continue.
Thank you. Thank you so much. Once again, thank you for this opportunity. I remember seeing Dr. Smriti in Rufaida College of Nursing, though she may not recognize me as I had a different name and gender when she was here. I transitioned only in 2019. So that's why she may not be able to recognize me. But yes, we have met previously, and I look forward to meeting you again in the new avatar. It's really nice, that colleges of nursing are now coming forward and addressing this important issue of caring for transgender patients and persons. And I say this having conducted sessions previously at for nursing students at Manipal and Jamia Hamdard also. And I'm really very happy and excited that today at AIIMS Rishikesh College of Nursing, we are doing this session. And I hope that this session is just the starting point and it leads to many more initiatives and developments which are necessary to ensure a dignified, respectful, and correct care of gender diverse patients. So what I'll be addressing today and what I'll be basically talking today is about the work that we are doing as transgender doctors and researchers. We are trying to look at the health needs of the transgender community. We know that the trans community is marginalized on all fronts, whether it is educational, economic, health-seeking behavior, health access, etc. But our focus is more on health needs, whether it is in the medical education or whether it is in the provision of healthcare by all healthcare workers, whether they are doctors, nursing professionals, paramedical staff, rehabilitation science professionals, or even mental health care professionals. And we believe that this is an important step towards achieving gender equity. Generally, when we speak about gender equity, you only think about men and women, but there are more dimensions to gender. There are not two genders, there are not necessarily three genders, there are many genders, and it's a social construct. And to ensure that everyone, irrespective of their gender identity, has an access to healthcare, we need to design our systems accordingly. Now, before I proceed, I would like to look at this very important quote. That when it comes to transgender people, unfortunately in India, they are either considered to be subhuman, that means below the level of human beings, or they are considered to be superhumans, in the form of divine people, people whose blessings have got tremendous power or something. Whereas most trans people want to be treated as just a human being. We do not want to be treated like gods, nor do we want to be treated like anyone who is below human. And what happens is, in case of a lot of us, we do not understand transgender people, and that is why we are afraid of them. I remember in my childhood, I used to be afraid of people of Hijra or Kinder community who would come to our homes, because we were told that they will pick up children, they will kidnap children, they'll take children forcibly away, they will castrate them and make them beg on traffic signals. So what happens is, what we don't understand, we generally start becoming afraid of that. And what we become afraid, then we start judging as evil. And then what we judge as evil, we try and attempt to control that. And what we cannot control, we start attacking. So when it comes to transphobia or hatred or fear of trans persons, a lot of it stems from a lack of knowledge and understanding regarding transgender people. And that is why this is an attempt that we understand about trans people, because they will be our patients, they may be our doctors, they may be our colleagues in the healthcare teams. Now, when I speak about transgender people, generally an image comes in front of our mind of someone who is from the Hijra or Kinder community. That's the predominant image. Most of us have seen trans people like this. But while I speak to the trans people, I want you to remember that trans people can be like this also. This is Aryan Pasha, a trans man, bodybuilder. So he is also a transgender person, and he can be your patient. Trans people can also be non-binary folks, those who don't identify as either man or woman. And this is the pic of a famous Hollywood actor who identifies as a non-binary transgender person. Quick stats, how many transgender people are really there? Unfortunately, we do not have a count. And we say that, in India, we probably have a good count of number of tigers, many of the animals, but we do not have a perfect count of transgender people. The last counting was done in the census of 2011. As you know, 21 census has not been conducted, and we were counted as 5 lakh people, of which 54,000 were children. And as you can see, the literacy rate is much lesser than the mainstream population. Let me tell you this, that this number is an understatement, it's an undercounting. The actual number of trans people may be as high as 10 times this number. This is because most of the people who are counted here in this 5 lakh are only those who had an ID card saying that they are trans persons, or those who identified themselves as a trans person. But there are many trans people who, because of the fear of the family, will not identify as a trans person, or may have chosen one of the binary genders and therefore may not have been counted. But irrespective of the number, whether it is 5 lakhs or whether it is 50 lakhs, as healthcare professionals, it is our duty to do the best that we can. Do not even have basic school education. Now, we may say that, I don't discriminate against trans persons. We don't discriminate against trans persons. In schools, children don't discriminate against trans persons. So why they don't have a school education? So a lot of times, because of the feminine behavior of the child or because of the behavior which is not in sync with what the society considers right, parents do not even admit their children in schools. And even if the child is admitted in a school, because the schools are binary, you have girls and boys, you have uniforms accordingly, you have sections accordingly, you have toilets accordingly. Transgender children feel that they're out of place. Transgender children also face extreme levels of bullying, harassment, and abuse from their own classmates and sometimes even teachers. And this abuse can even go to the extent of sexual abuse. And that is why, even if a trans child gets admitted in a school, the dropout rate is very high. I can tell you from my own experience, I studied in an all boys school as a transgender child, and I couldn't talk about my experience with anyone. So that is why a lot of trans people are left in the education race. And if they're left in the field of education, then naturally they will find it difficult to get a job. Most of the qualified people are now finding it difficult to get a job. So even if a trans person is qualified, they find it difficult to get a job. So how do they survive? A lot of trans people, you will see that they'll beg on the traffic lights, and that's how most of us have seen them. Or you may see them involved in sex work, or you may see trans people's giving badhai on the birth of a child, during weddings, dancing, performing, and that is how they earn their money. These are the traditional livelihood methods of the transgender community. But it is important to understand that a lot of trans people are also working. Now, while transgender people have existed since, a very long time, and there are historical records of trans people in our mythology. There are records of trans people in Mughal darbars, in the British times, and all. Things have not been very good, especially in the last, few centuries, if I may say. So what happened is, during the British rule, the trans persons were categorized in the Criminal Tribes Act, which means that all trans persons by default were called criminals, and they could be arrested even if no offense was committed by them. Wearing clothes of women by biological males was a punishable and criminal act in British rule. And naturally, begging, sex work, all these were not allowed. Section 377, as you also know, was a British rule. And therefore, till the time of independence, when the Criminal Tribes Act was valid, trans people have been treated as criminals. They could be arrested without any offense. Post-independence, while the Criminal Tribes Act was removed, trans people were not legally recognized. Our constitution talks about only men and women. Our laws only talk about men and women. And therefore, for a very long period of time, for nearly 6 decades, trans people did not have a legal recognition. That is why they did not have legal recognition to even vote in our country. It was only obtained almost some 12 years back. But it was the Nalsa judgment which finally changed the things. This was a judgment by the Supreme Court, which came in 2014. And that judgment said that apart from men and women, transgender people will be identified as the third gender. And they should also be entitled to all the rights that are guaranteed to a citizen of this country, whether it is education, employment, healthcare, voting rights, etc. After that, another important landmark thing which happened, I would say, is in 2018. As you know, the section 377, which talks about unnatural sexual offenses, was read down by the Supreme Court of India. And a very important development which happened before that was the IPS position statement. IPS is Indian Psychiatric Society. So previously, people who identify as transgender were considered to be mentally ill, were said to have gender identity disorder. They were all considered to be people with a disease or a disorder. People with homosexuality were considered to be sick, were considered to be mentally ill. And both the categories of people, trans people and gay people, were given conversion therapy to convert them into normal human beings. That conversion therapy sometimes involved giving electric shocks to people. It was nearly 50 years back that in USA, the American Psychiatric Society had said that homosexuality is not a mental illness. But it was only in 2018, just 5 years back, that in India, the IPS position statement came, Psychiatric Society's position statement came, and it was no longer said to be a mental illness. And that's how Section 377 was read down, which also affected trans people, because trans persons who are involved in sex work also engage in anal sex, which comes under the definition of unnatural sexual offenses in Section 377. It was in 2019 that the Transgender Persons Protection of Rights Act came. So previously it was the court, and in 2019 it was the Parliament of India which said that trans people also have a legal recognition, they have rights, and they are protected under this law. In 2020, the rules of the law came. And in 2021, something very interesting happened, that the Madras and the Kerala High Court took note of how our medical curriculum often demonizes trans people. And it said that conversion therapy has to be banned, medical curriculum has to be revised, trans patients have certain rights. And in 2021, the National Medical Commission, which governs medical education in India, said that doing conversion therapy will be a professional misconduct, not a crime, but a professional misconduct. And that's how conversion therapy was banned by the allopathic practitioners. In 2022, that is last year, health insurance was launched in the form of Ayushman Bharat PG Plus card. So as you know, Ayushman Bharat scheme is already in place. The government of India added the TG Plus card also, which means that all trans people are now entitled to this health insurance also. So I was mentioning in 2021, two courts of India, Madras High Court and Kerala High Court, took cognizance that how our medical textbooks, nursing textbooks, healthcare sciences textbooks talk about trans and gay people as people with disease, as people with pathology. So it asked the respective commissions to revise the curriculum, to be in sync with the law, and to also teach doctors so that they can care for trans folks and sexual minorities in an empathetic and a respectful manner. And that's why the National Medical Commission revised the medical curriculum, and sodomy, lesbianism, all these terms have been removed as unnatural sexual offenses. And it has come out with a curriculum which now talks about how doctors should be treating patients from gender and sexual minority groups. As I also mentioned, following the Madras High Court order, the Medical Commission said that conversion therapy is a misconduct. Any doctor who does this will face the consequences, including removal from medical register. But while things may see that, okay, fine, like now we have got the rights, we've got the law, we've got equal status, there's no discrimination. But remember that discrimination is still present in certain aspects. And just to give one small example, there is a case going on in the courts of India, which says that trans people should be allowed to donate blood. Now, you'll be surprised to know that transgender people and gay folks, men having sex with men, are not allowed to donate blood. This is because the government, under National AIDS Control Program, has categorized transgender people and gay men under the high risk category as people who have a higher risk of HIV. And therefore, there is a permanent deferment, which means that they are never allowed to donate blood. And I can tell you my own personal experience that when I went to donate blood, I was not allowed to donate blood as a trans person. Though, the current scientific evidence suggests that this ban is unscientific. It has no scientific rationale because not all trans people are sex workers. Not all trans people are engaging in unsafe sex. Tests are very easy to do. So there are antigen tests that can detect people even in window period. And therefore, any such kind of a rule which excludes an already marginalized group is inhuman. And it's sub judice. The court is looking into the matter, and let's see what happens about it. Just highlighting one small example of how we may think that there's no discrimination, systematic discrimination, but such discriminations still continue. Now, one very important thing to understand that we may say that everyone has equal need of healthcare. Trans people are like everyone, and therefore they also need healthcare. And I want you to understand this, that trans persons have a higher need of healthcare as compared to cisgender people. Let's understand why is that the case. One is, the mental illness and suicidal ideation and attempt is more in transgender persons. Because as Dean ma'am also mentioned, a lot of trans people, they face exclusion from their home. They have to leave their families and stay outside. They don't get support from their colleagues, their fellows, even their family members. And that's why levels of depression and suicidal ideation and attempt can be higher. So there's more need of mental health care for them. To cope up with these stressors of life, a lot of trans folks engage in harmful substance abuse, from cigarette, alcohol to even injectable drugs. A lot of trans people are not able to visit hospitals, and therefore they go for self-medication, including self-medicating themselves with hormone therapies like estrogen and progesterone to bring about the desired body changes. Transgender men, that is those who are biologically women, but their gender identity is that of a man, have a uterus, they also menstruate. But since they identify as a man, they find it very difficult to access washrooms for changing their pads. They find it very difficult to visit a gynecologist, right? Because it's only for females that OPD. So the menstrual disorders are often undiagnosed and untreated in trans men. For survival reasons, a lot of trans people engage in sex work, and that leads to, and that sex work involves anal sex or oral sex, and therefore that leads to increased risk of STI and therefore HIV. We must also understand that preventive services are less available to them, whether it is NCDs or cancers. A lot of us may go for things like breast cancer screening, pap smear examination, etc. For a trans person to go to the OPD to access these services is difficult. Many trans people who want to affirm their gender may want to go for a gender affirmation service, what we usually call as a sex change surgery. But remember, that's not a technically right term. We don't use the word sex change because sex cannot be changed. The term that we use is gender affirmation service. This can involve surgical procedures. This can involve hormone replacement therapy. It can involve laser hair reduction, medical therapies, etc. Most trans people do not have health insurance, public or private. They have a lack of family and friend support, which is very important in healthcare, and also a poor awareness and affordability of healthcare services. And that is why they have a higher need for healthcare, but receive lesser than the general population. Now, there are barriers, that we need to understand to accessing healthcare. And many times this barrier is at the patient level, at the level of the family. So there's a lot of stigma and discrimination, body image issues amongst trans people. If I have, for example, pain in the abdomen, and I want to go to a doctor where I'll have to undress, expose my body, I may even have to undergo a sonography. I may not feel comfortable because I may not be treated in my own gender. And you are seeing me now and like this, so it may be like, okay, I may not face any discrimination. But when it comes to trans persons, so I've shown a photo here. This is the photo of a trans man who has their breast surgically removed, as you can see. But the scars cannot be hidden, right? Even when they are a trans man. Now imagine this trans man simply has a cough, cold, fever and wants to go to a doctor. And the doctor asks them to open up their shirts so that they can auscultate the chest or they can examine the chest, and they look at the scars. Now the doctor does not know what to think of it. Why are those scars present? How do I now address my patient once they know that they are transgender? So because of this, for even simple things like cough, cold, people may not go for medical provisions. They may have a past negative experience. Last time I went to this hospital, the doctor didn't treat me properly. I was not allowed to stand in a women's queue. I was mispronounced. They kept calling me sir instead of madam. And therefore, I don't want to go to this hospital now. So many times, there is perceived discrimination. So because of which people don't access healthcare services. Also, the access, availability, affordability, and quality may be poor, right? Many times it's not accessible to me. It may not be available. It may not be affordable for a trans person who is anyways economically deprived. And the decision making is also important. Who decides that a trans person should get healthcare treatment? Is it their family members? Is it their guru in the Guru Chela system? So many times that's difficult. And this is especially the case when people want to undergo gender affirmation services, right? So gender affirmation services, many times, I may want to go it, but my parents may say, don't go for it. My partner may ask me not to go for it. My guru may say that I should not go for it. So many times, even when the service is available, people are not able to decide for it. Then what are the barriers that are present in our healthcare system? Even if a transgender person wants to come and take treatment, there will be barriers. One is lack of availability of services, accessibility, affordability, and quality. Did you know that in India, how many hospitals provide gender affirmation service? So we did an RTI to find that out. And to our surprise, there were hardly any hospitals, government hospitals, that provided gender affirmation services. People come to Delhi for all kind of services, healthcare services. You have AIIMS, you have Safdarjung, you have RML, you have good private hospitals also here. But in Delhi, to your surprise, not a single hospital, government hospital, performed gender reassignment surgery. So we asked AIIMS Delhi, we asked Safdarjung, we asked LNJP, none of them performed sex reassignment surgery. And the surgery is available only in the private hospitals where they'll cost nearly ₹500,000. So from where will a trans person afford this? Then there is a lack of sensitization. As doctors, in my course, I was never taught about transgender people. So when a person from the Kinnar community walks in, I don't know how to greet them. I don't know what kind of pronouns I should use for them. I don't know if they get admitted in a hospital, we should give them women's clothing or male's clothing. We should admit them in male ward, female ward. What should we write on their case paper? I mean, no one has told us that. There are no SOPs in place. And therefore, we are not able to do it. Something as simple as putting a catheter, a urinary catheter. We know that this is the number of the catheter for men, this is the number of catheter for women. What number catheter will you put in an operated transgender person's urethra? People don't know, for example, how to even estimate hemoglobin. You have normal hemoglobin for men, you have normal hemoglobin for women. Where is the normal range of hemoglobin for transgender persons? So there is a lot that the healthcare system, needs to do in terms of making it even competent for the transgender people to come to us. Now, I want to, say this, that I'm sure all of you are inspired, by listening to all this key. Oh, yes, a lot of bad things are happening to transgender persons when they come to our OPDs, to our hospitals. And people say, oh, but what can I do? I'm only one, but this is an important quote that I want you to read and understand, that even though you cannot do everything, what you can do is very small thing. And for that, you don't need any rule, you don't need any law, you don't need any court order. Something as simple as like asking a person what name they want to be used for them. It's okay, whatever name you put in the legal document, but just while talking, if suppose I want to be called Pinky, though my name is Aqsa Shaikh and that's my pet name. If as a nurse, you address me as Pinky, I'll definitely like it, But if you insist, no, your legal name is Aqsa Shaikh, so we'll call you Miss Shaikh and all. I'm like, okay, fine. What difference does it? If I want people to use female pronouns for me, though my legal ID says male, how does that matter to anyone? You are not doing any crime or breaking any law by doing that. The law says that there should be separate wards for transgender persons in hospitals, in addition to male and female wards which are present. And it is our problem, it is our mistake as hospitals that we have not been able to provide those wards to them. And in the absence of those wards, you should give the choice to a transgender person whether they want to be in a male ward or a female ward, right? Something as simple as giving them the clothing of their choice when they are in the hospital is these small things, can make a large difference. You don't need huge courses or degrees in transgender medicine. You don't need big SOPs. Something that you can do at an individual level. Let's start with that. I'll be telling you certain things which, since the administrator is also here today, so this will be important for them, and it's also important for us at individual level. First and foremost thing is, decriminalization, depathologization, and demedicalization. Three important terms. Decriminalization means that we need to understand that trans people, sexual and gender minorities are no longer criminals in the eyes of the law, right? And therefore they have to be treated accordingly. Second is, all the health and disease classifications have now been revised, and trans people and gay people are no longer considered to be suffering from any disease, physical or mental. So we should also stop treating them as someone with a disease. They are as normal as anyone else. And third and important thing is to demedicalize it. We should stop thinking of trans people only from their genitals. That these are the people with abnormal genitals, or these are the people who are men in women's body or women in men's body. Remember that trans people are human beings. And as human beings, they also have other healthcare issues like any other human being has. And therefore, we should stop looking at people only in terms of their bodies or only in terms of diseases or laws. So I've listed out certain things. I was talking about Criminal Tribes Act, no longer applicable to trans people. Section 377, no longer applicable. NALSA judgment came, Transgender Act came. But two important things are still to be done. the blood donation guidelines still exclude transgender people, and surgeries on intersex children are still being performed. Intersex children are children with ambiguous genitalia, as Professor Jaya was mentioning. So as ma'am mentioned, that sometimes children are born with ambiguous genitalia and the parents don't know what to do. So they want the child to be converted into either a male child or a female child. And during this process, some surgeries may be done on the child's genitals, which can scar the genitalia for a lifetime. And remember, these are not necessary surgeries. So we advise against such surgeries. Intersex children can be raised as intersex children, and once the child becomes older, they will understand who they are. So unfortunately, these surgeries are still happening and there is no law to prevent it. So that's another area that we are working on. Then ensuring that a health for all mantra is also applicable for trans and gender diverse individuals, whether it is in our essential healthcare like vaccination. So during COVID vaccination, for example, a lot of trans people face difficulty in accessing vaccination, whether it is gender affirming care or whether it is mental health care. Everything has to be inclusive of people of all genders. We need to make sure that our healthcare is competent, and this can be done by change in the healthcare curriculum. So as I was speaking, the National Medical Commission has made these changes in the medical curriculum in the subject of forensic medicine and psychiatry. We also now have a competency-based nursing education, which does not directly speak about trans people, but talks about gender equity. And there is a good opportunity to also introduce this in the nursing curriculum. We also want changes to happen in postgraduate curriculum, postgraduate medical, postgraduate nursing curriculum. A lot of doctors and nurses have now come out of the medical college. So how do we ensure that they still have the knowledge and skills for treating trans people? So we need continuing medical education, continuing nursing education. And very importantly, we need a healthcare policy for trans persons. Unfortunately, India still does not have a health policy that talks about trans people. We don't have a transgender policy also. So that is something that we need desperately. Lastly, I want to say this, is that as doctors, as academicians, as researchers, we want to work for trans people. We really feel that this is a group whose rights have been taken away. We need to work for them. But what happens in this is we forget that the people for whom we want to work should be included in this work, right? So if you are going to work for the transgender persons, then you should work with the transgender persons. And one way of doing that is to involve them in everything that you do for them, right? So I'm very happy that today, when you're talking about transgender persons, you've invited a transgender person to speak on the issue. If tomorrow you do any seminar, you do any conference, please invite transgender people, and not just transgender people who are doctors, researchers, academicians, but ordinary transgender people who are extraordinary in their own ways. Please ensure that your hospitals have access to transgender people. Many times, if they are not able to go, we all go into community, right? We have community nursing, we have community medicine. Please visit the deras of transgender persons, see how they're living, how they're accessing healthcare, where do they go when they have a fever. Next time you meet a transgender person at traffic signal, maybe just stop, ask them their name, ask them a very simple thing: where do they go for washroom? No, they are at the traffic signal, the only male and female washrooms in the city. So where do they go for washroom? How do they pee? Something as simple as that, can start a conversation and can make us, more caring for people who are different from us. And I think that's the message that I want to give today on this very important day. Thank you.
Thank you so much, ma'am, because this was totally untold, and we were totally unaware of many things that you had discussed today with us. Thank you for that. And each transgender person should be recognized for who they are. Human beings deserving respect, dignity, and equality. So when we build a society that accepts, celebrates, and uplifts transgender people, we create spaces where all can feel understood and respected. So these acts of acceptance can advance and enshrine the rights of the transgender people in the fabric of our society. So this is a responsibility we all share. We all should understand our responsibility. And honoring the International Transgender Day of Visibility is critical in the fight for the transgender rights and equality. So, by recognizing and supporting the transgender community, we can create a world that is more just, equitable, and accepting for all. So now, shall we have the presentation from the Sangha group? Thank you. Over to you.
Thanks, Jyoti. Thanks a lot, Aksa. I think all of us are here. One of our colleague is not here. So maybe if I can request my other colleagues, Rajan or Gaurav, to quickly check with Bhakti and see if she is able to join. So maybe we can wait for a minute and then we will start. So if you all can just give us 1 minute or two, and then we will start.
Meanwhile, Sally, can we have a quick introduction of all?
Yes, I was thinking, yeah, sure. So, my name is Salik Ansari. I work as an assistant coordinator with Sangth Bhopal Hub. I also work as a co-member secretary of our institutional review board. By training, I'm a research ethics master's graduate. So that is about me. I see myself as an early career researcher and writer. So over to you, Gauri, if you want to go next.
Hi everyone, I'm Gauri and I work as a research assistant for Drishti and Kinship, which are two projects at Sangat. I've studied psychology in my undergraduate years, and I have a postgraduate diploma in the subject also. I see Rajan and Gaurav. Thank you.
Yeah, hello everyone. So I'm Gaurav Prateek and I'm working as assistant coordinator in the Transcare Queer Ambassadors project in Sangat. And I have my background in media and working in the direction of gender, sexuality, and marginalization, and finding out intersectionalities with media. It's something that I'm interested in, and also have been supervising a lot of audiovisual work and audiovisual production at Sangat since I have been here. Over to you, Rajan.
Thanks, Gaurav. Hello, everyone. My name is Rajan. I'm a trans queer non-binary person. I have trained in media and I've worked briefly in media houses and publication houses. Right now, I'm working as a project assistant in I Hear PS for Equity. And I think my interest lies also in media and marginalization, and most probably at the intersection of both. Yeah, good to see you all here.
So all these names that we are hearing, Peers for Equity, Kinship, and all that, these are all our different projects, and we'll talk a bit about more in the presentation that we have. Rajan, do we have any update from Bhakti?
I think we can start soon.
Okay, sure. So if the host can enable my screen sharing option, that will be very kind. So we have a brief presentation.
Yes, done. Please go ahead, sir.
Yeah. Okay, so if all of you can see my screen, it's loading right now. Yeah. Okay, so this is a very brief presentation that we have prepared for all of you. It will talk about our group, which is I Hear. I Hear stands for Initiative for Health Equity, Advocacy and Research. So who we are, what do we do, what are the different projects that we are involved in, and it will relate to what are some of the things that Aqsa Shaikh discussed in her talk as well. So starting from Sanghat, so you might have heard in our round of introduction, all of us were saying that I am from Sanghat or I work with Sanghat. So, what is Sanghat? Sanghat is a 25-year-old non-profit organization with our central office in Goa. But then we also operate in other states. So we operate in Bhopal, in Madhya Pradesh. We also operate in Delhi, and then we are also based in Pune in Maharashtra. Our key area of work is mental health and public health, and we are a research intensive organization. So, a lot of our projects are in and around large scale research studies, but then a lot of our projects are also focused on implementation and capacity building, and we'll hear more about it in a while. On the screen, I have written some of the prizes that we have won as an organization, and we are very proud of those awards that we have won, like the MacArthur Foundation Award, WHO Public Health Champion Award, etc. And we also have collaboration and memorandum of understanding with different agencies and government department and organization, such as NHSRC or Department of Public Health and Family Welfare. On this screen are some of our funders, collaborators, and partners. Some of them are based in India, some of them are based outside of India. So these are the people who support us, who fund us, who encourage us in doing the kind of work that we do. Now, talking about the work that we do, so I Hear is where me and my colleagues, all of us work together. What I hear is that it brings together academics, researchers, activists, practitioners, and community representatives. And together, what we do participatory research, we do advocacy, we do capacity building. We are also involved in sensitization and awareness building in and around the focus area of intersectionalities of various different marginalized identities, health access, health equity, as well as mental health. There are certain values that we hold together in our work. First one is equity, so working towards improving equity in healthcare. Intersectionality is another value, so recognizing intersectionality in experience of marginalization. So all of us have different identities. We don't live with one identity. We have a religious identity. We may have an economic identity. We have our identities around gender, sexualities, etc. So recognizing the intersections of all those unique identities, which together shape our experience. From experience, so lived experience as expertise, something which Dr. Aqsa also mentioned in her presentation, a phrase, nothing about us without us. So we are the experts of things that affect us or things that we identify with. Uh, Scholarships are working towards quality, high quality scholarship, academic output, which is scientifically sound as well as ethical. And finally, working towards real change, changes in the lives of people on the ground. So these are the values that we hold. Now, different projects that we work on, and some of my colleagues must have mentioned these names as they were introducing themselves. We'll talk about briefly about these projects in detail. I'll just mention the projects with which we started, and then my colleagues will take on. So we started our work with the first project that you see on the top left of your screen, Transgender COVID-19. It was a participatory research project where we were trying to understand the experiences of transgender population in accessing healthcare in the backdrop of COVID-19 pandemic. It was a qualitative research study, and that was one of the first projects with which we started, and Aqsa was also involved in that project. The second project that we worked on soon after that was geared towards transforming medical curriculum and making and introducing competencies of including competencies of trans and queer inclusion, and working towards reforming the medical curriculum to making it more inclusive of trans and queer communities. So these were the two projects that we started with, and then subsequently other projects got added in the list of things that we were doing, and my colleagues will talk about it one by one. So do we have Bhakti with us? Has Bhakti joined?
Yeah, Bhakti is here. Bhakti is joined as SBT. Hi,
Yeah.
Bhakti.
Hello, can you
Hi.
hear me?
Yes,
Yeah.
yes, Bhakti,
Yeah.
we can hear you. So over to you, Bhakti. But if you can also briefly introduce yourself, Bhakti, and then talk about vaccine equity. Yeah.
Okay. Thank you, Salik. So, hello everyone. My name is Bhakti Ghatole. I'm currently working as a research assistant in Sangth I Hear project, vaccine equity. I'm 100% visually impaired, and my pronouns are she and her. So, talking about vaccine equity. So, vaccine equity is funded by Sabin Institute. It started last year. The main aim of this project is to deconstruct structural inequities that shape COVID-19 vaccine access and uptake among the trans and disability communities in India. So for this, we collected interviews of the community members, key informant interviews, and also we did photo voice story method. So we took around 41 interviews of trans and disability participants and key informant interviews of vaccine providers, vaccine programmers, community leaders, vaccine advocates, etc. And also in photo voice stories, so participants could represent their experience of vaccination through photographs. So these photo stories are available on the website link. Then the research approach for this study was participatory research, where representatives from both the communities were involved in all the levels of research. So, for example, we took their inputs on interview guide, data collection, data analysis, and also dissemination plan. So after the analysis, 4 themes that emerged out of the study was lack of need-based approach in vaccine information dissemination. So for example, there was there was absence of information on HRT and its interaction with vaccination. Then negotiating trust in vaccine. The next was procedural infrastructural barriers. So for example, participants faced like inaccessibility in COVID app, transportational inaccessibility, and also lack of ramps on the vaccine center. So various barriers. And last was neglect. So after vaccine equity, this year we are moving to vaccine equity 2.0. So here we are aiming to expand WHO's BSD framework and survey tool for trans, intersex, and disability community, where like to measure factors that would drive adult vaccination. So it will be a mixed study approach, and we are about to start that. So thank you, everyone. I would like to invite Rajan to talk about P4E.
Thanks, Bhakti. Thank you so much. Hi everyone. I'll be speaking about PS for Equity. PS for Equity, or P4E, is a peer-led and peer-focused participatory capacity building initiative for evidence-based advocacy among disability and LGBTQI plus community. A large section of these two communities remain deprived of appropriate opportunities to develop themselves to realize their fuller potential due to historical and contemporary discrimination. P4E aims to co-create spaces with community members to respond to this gap, because there's a need to develop localized and contextual solution by the community for the community, in line with the loud and clear call for nothing without us, about us. Now in P4E, this is done by 4-week digital course on research and evidence-based advocacy that is free to access. The course is comprised of short videos on 10 to 20 minutes each on topics such as what is research, how to do research, what are the methods of research, how to make research more accessible to the disability community, how to do ethical research towards the community. What are the tools of advocacy? What is advocacy? Why is advocacy needed? And also, what are the new tools of advocacy? All of these videos are recorded by the people from the community who are doing the research and advocacy work at the ground level. Um, these videos are recorded for people who are who have zero or no prior exposure to research or advocacy. For this digital course, we recruited 100 participants, leveraging our partner organization Sathi contacts and network. We also advertise it on our social media, and that's how we were able to have 152 participant learners on our course. The course videos are recorded by the researcher, as already said. Right now we have 12 hours of pre-recorded videos and 4 live webinars, which were also taken by the people from the community of 2 hours, and this which was delivered in 4 weeks. And after the digital course, a small section of 23 people was selected for paid mentorship fellowship program, where they're hosted at partners organization of higher Sangth, such as Tweet Foundation, Rahi, Sayatrika, Amigos, etc. And these 23 fellows are also mentored by the mentors from the disability and queer community, in helping who are helping them in developing a plan, a fellowship output, which can be an advocacy-based plan or a research proposal or a policy brief. We also have an in-person induction event, which was organized in Bhopal, uh, where all the 23 fellows participated, which was aimed on peer learning and capacity building. As I said, capacity building, we also have capacity building sessions on different topics to help the fellows in building their fellowship output, such as writing research proposal, making policy briefs, advocacy plan, a sensitization workshop plan from the community members. These sessions are recorded and made available made available to our fellows on our learning management system. The fellows right now are working on their fellowship output, and they will be submitting their fellowship output, which will be disseminated and shared with the stakeholders in the dissemination event, which is planned in 2023 May. Yeah, that's it about Peers for Equity. Now I would like to call my colleague Gaurav, who will speak about Transgender Queer Ambassador. Thank you.
Thank you so much, Rajan. Hello, everyone. Very warm good afternoon to all. So, building upon the series of projects that we have at I here, we have Transcare Queer Ambassadors project, the project in which I'm also working. So, the Transcare Queer Ambassadors project is a project that aims to make the medical college campuses, the health professional education college campuses, queer and trans inclusive. The main aim of this project is how to make these very campuses, the spaces within these campuses, inclusive for people from the queer and transgender communities. And this project brings together health professionals, students, faculty, and staff. And it provides a mentored studentship to all our queer ambassadors. So right now we have selected 8 queer ambassadors who are medical or health students from 8 different medical colleges across India, and we provide them with a mentored studentship. Most of these students who are queer ambassadors are from the queer community, and also the mentors who are providing them a monthly mentorship are also from the community. And their main aim is to create advocacy for campus inclusion using innovative methods. So they use a lot of innovative methods, and their methods are not just limited to traditional methods of creating advocacy and awareness. So they use performing arts methods and other various other arts-based methods, opening of queer clubs, opening of platforms for queer students, queer staff, queer faculty to interact and share their emotions and thoughts, etc. And the main focus of this project is, as I said, to make the HPE health professional education campuses queer and trans affirmative, to make the healthcare spaces, the emotional and physical spaces where these students go to study, and the spaces, the campus spaces that shape their lives through at a very larger level, how to make those healthcare spaces queer and trans affirmative, and how to also advocate enthusiastically about queer and trans affirmative campus policies. Campus policies may include, opening up gender neutral washrooms, providing other than Mr. and Mrs. on the admission forms, etc., etc. So on every level, a huge amount of work has to be done in order to make the campuses inclusive. And this is what this project aims to do through these 8 queer ambassadors that we have selected. And it's the first, it's Trans Care Queer Ambassadors 1.0. And we would also like to take it further. And we also are trying to see how the work that has actually started and that our queer ambassadors are actually doing, how to sustain that work even when they go out and pass out from their campuses. The main highlights of this project is that, as I said, it's a pan-India project. We have 8 queer ambassadors who have been offered the studentship from Sangth. And these 8 queer ambassadors belong from 8 different health professional education colleges across India. There are 8 participating colleges as a result and 6 participating states. So the colleges that we have University College of Medical Sciences, New Delhi. We have Jorhat Medical College, Assam. We have the Public Health Institute, Gandhinagar, Gujarat. We have AIIMS, Bhopal. We have 3 colleges from Tamil Nadu, including the Madras Medical College, the Dhanalakshmi Srinivasan Medical College and Hospital, and Panimalar Medical College and Hospital. So as you can see in the first stage of the Transcare Queer Ambassadors project, we have effectively been able to cover different states, different socio-cultural and political scenarios where these colleges are located, and working continuously in order to start this change of making the campuses queer and trans affirmative and inclusive. As a part of this project, we recently collaborated with the London School of Economics. So the Department of International Development from the London School of Economics collaborated with the Transcare Queer Ambassadors Project. A team of 3 student consultants from London School of Economics conducted a study with our queer ambassadors on campus inclusion scenario in India. And the major aim was to develop a benchmarking tool for campus inclusion and to understand the campus inclusion present scenario and future possibilities in India. Next slide, Salih. Extending further, we recently also collaborated with National Institute of Social Defense, New Delhi, an organization that actively works for the welfare of transgender community, creating awareness and advocacy for the same. And as a part of this collaboration, we were generous to receive a good amount of funding from National School of Social Defense, which was utilized to conduct a series of 2 workshops titled Transgender Persons Protection of Rights Act 2019 and SOGIS Sexual Orientation, Gender Identity, Gender Expression, and Sex Characteristics Competencies. We covered 2 colleges in Delhi, Jamia Hamdard, the University College of Medical Sciences, where in both of the colleges, we saw a large number of turnout of medical and health students, staff, and faculty who were open to learn about these competencies and sensitize themselves in order to how to provide healthcare access and services to the people from the queer community and transgender community and disability community in an affirmative manner. The target audience were health students, faculties, staff, and professionals. Now, the recent initiative that we have come up with TAP, which is also known as Doctors for Equity. So Rajan just spoke about Peers for Equity. This project is Doctors for Equity. So this project is an extension of Transcare MedEd 1.0. So just a brief about what was Transcare MedEd. So the full form of MedEd is medical education. So the Transcare MedEd project aimed at how to revise the medical curriculum in order to make it inclusive and affirmative for people from the queer community and transgender community. And that project also came at the backdrop of several court judgments in India that directed various medical institutions and organizations to revise their curriculum and make it more inclusive and affirmative for people from the queer community. So that was Transcare MedEd 1.0. The Transcare MedEd 2.0 under the DAP initiative will continue to build on the efforts from the earlier project, Transcare MedEd 1. This project aims to reduce inequality within the medical education and the healthcare system by sensitizing them to the needs of LGBTQIA plus community and equipping them with the competencies to develop, to deal empathetically with their healthcare, as far as healthcare and healthcare services are concerned. And as a part of this project, what we aim to do is we aim to structurally reform the training of medical professionals in India and thereby building a LGBTQIA plus affirmative cadre of doctors whom the community can reach out to for their healthcare needs at any point of time. So this is very important in order to how to train the doctors and the medical professionals itself, themselves, so that they become fully sensitized and they develop those competencies that can be utilized to cater better to the transgender and queer community at the large. Thank you, Salik. Over to you.
Thanks, Gaurav. So another project under the I Hear umbrella is the Kinship Project. This project aims to conduct qualitative research using a community-based participatory approach to understand how kinship works in the older queer population of urban India. So overall, understanding questions of community, social support, access to healthcare, and questions of inheritance and legality among older queer people. How it was conceptualized is that the elderly from the queer population in India is less visible in conversations around the rights and well-being of sexual minorities. And we hope that the outcomes from this research will be used to guide future inquiry on this topic, which can help lawmakers, health providers, and community members better address the healthcare and other needs of older queer people. These could include bringing in laws and policies that recognize different forms of kinship when it comes to things such as nomination in inheritances and insurances, as well as decisions about healthcare. Salik, I think you can take over from.
Thank you. Thanks a lot, Gauri. So we heard a lot about the different projects and what is it that they do. I'll just speak in next few slides about some of our overarching work. So one arm is of course media engagement. So engaging with media to talk about the relevant issues of the day. So either directly contributing to write-ups, output, or when other journalists and other people from the media community, when they are writing, they approach us and we provide necessary inputs, which is included in the output that they write. So that is one. I have added some screenshots, some snapshots from some of our media engagement. Public events, so that is engaging with the general public. So this is an event where we are talking to young people in Bhopal about gender, sex, and sexuality. The event was called Bate Unlocked, and this was in collaboration with another organization called Purpose. And what we talk about, so we talk about the same things, awareness and sensitization about issues of SOGISC, issues of gender and sexualities, etc. So that's a different cadre of population that we engage with. Likewise, campus events. So we have Dr. Aqsa and Dr. Satyendra Singh giving seminars and talking about disability rights and transgender rights at AIMS Bhopal and the National Law Institute University, NLIU Bhopal in 2022. Some training for the general public as well. So this was a webinar series on disability and transgender and non-binary inclusive research. We had invited 4 delegates whom you see on the right side of the screen. And this was an open event, so anybody who is interested can register and attend an event. We had some 50, 60 plus attendees for this event. So that is another kind of engagement that we do. Gaurav spoke a bit about the Transcare Medid. That project's dissemination, the culmination of the project, happened through a national conference which focused on trans affirmative medical education on 5th and 6th of May in New Delhi. This is a snapshot from that presentation. In the presentation, of course, in the conference, of course, we disseminated the findings from our project. But then we also had invited different stakeholders, so people from the government, people from the media, general public, people from civil society, etc. And we had a lot of engagement, conversations, panel discussions around the relevant issues of the day. So talking essentially making health education and healthcare inclusive of trans, queer, and other marginalized identities. Some more pictures from this event. I'll just pause for 10 seconds for all of you to have a look at this picture, then I'll proceed. The team, so some of us are already here. Gauri is here, I'm here, Rajan is here, Gaurav is here, Bhakti is here. And these are other members of our team. So we have Deepak, who's a public health management professional, Anand, who is a leading bioethicist, Hari, who is a senior project coordinator, public health professional, Sharon, who is a psychologist by training, Ashwarya, who studied Dalit and tribal studies at TIS, Shreyas, psychology graduate from Delhi University, Chaitanya, who holds a BA in economics, Ardra, who holds MA in political science, and Bhakti also is here today, MSc psychology. So that's our team. All of us are based in the Bhopal hub of Sangth, but then we also have collaborators like Aqsa, Satyendra, and external collaborators in whose guidance and mentorship we work on all of the projects that we talked about. This is the last slide that focuses on how all of you from the nursing community who work in nursing education or work in campuses where nursing education is taught, how you and all of us can work together, come together and work on issues that we believe requires attention. So 3 points have been listed on this slides and there could be more. One of it is to work together on sensitization. So sensitizing nursing communities, essentially talking more about the things which Aqsa talked about in her talk. So taking that work forward, that is one area of collaboration. Working towards making campuses and curriculum inclusive. So how campuses where nursing is taught can be inclusive, what to do, how to do, who will be doing it, etc. So those are the areas we can come together and work. Finally, where all we need evidence, where all we have to do research to find out something and then to implement. So these are some of the areas. Third one is evidence creation. Second one is making campuses and curriculum inclusive. As first one is sensitization events and workshops. So all of these are the areas where we can come together, and AIMS Rishikesh, for instance, can take a leadership role if you like. And also as we learn to document some of our learning and then taking our learning to other institutes in and around nursing and other areas where what we have learned can be adapted and implemented as best practices by other institutes as well. So this was my last slide. I'm going to invite Aqsa if you want to add anything to what all of us spoke so far, specifically with regards to area of collaboration, but if there's anything else also you would like to add. So first Aqsa, and then we can open the floor for comments, questions. So Aqsa, if you can hear me, over to you.
Yeah, thanks, Salik and the team for a wonderful brief of the work that Sangth is doing. And the reason why we shared this is also to take this further in the form of a collaboration with the College of Nursing at AIMS Rishikesh. We are collaborating with a lot of other campuses, and I think it's important to take this conversation further in the form of a collaboration. So we are very keen to visit the campus sometime and also discuss about how we can collaborate and make the campuses and our healthcare services trans-inclusive. Thank you.
Thank you, Sangha, for that lucid presentation, and thank you, Aqsa. Now the floor is open for discussion. Anybody has any questions or anything you want to add on to? Kindly come forward. You can get your doubts clarified, and if you have anything to ask, anything to suggest, please come forward.
There was a question in the chat box. So till other people can think of a question, I can answer that.
Yes, sir.
That question was by Yasmin Mansoori, asking if there is any special care for trans patients in nursing, or can we give medical care like any other patients? Well, I would say the answer is both yes and no. No, you don't need any special care because, as I mentioned, you ultimately, the basic principles of treating any other person with empathy, dignity, respect, providing correct care to them, the right treatment at the right time to the right person is what we have been emphasizing. And that holds true whether you are treating an adult or a child, a man, woman, trans, or a non-binary person. But at the same time, we also know that now the nursing field has also expanded a lot. You have pediatric nursing, you have cardiovascular nursing, you have nursing anesthesia, and so on. And therefore, similarly, for a lot of other procedures, there may be some kind of a special care needed for trans and gender diverse folks. To give you one example, I'm sure you must have all heard about recently a trans man who conceived, got pregnant, delivered, and had a beautiful baby in Kerala. Now, if such a trans man comes to your college, in the ANC clinic, in the labor room, and he needs the care throughout his pregnancy, intranatal, postnatal period, how are you going to take care of such person? Now, it's as simple. That person is a person, that person is a mother, father, whatever you may want to say. But what does the person want to be called? Do they want to be called a mother? Do they want to be called a father? So there's a lot of work, for example, that's being done in Australia on nursing, obstetric nursing for trans and gender diverse persons, where certain terms which are very ingrained in genders or sex, like breastfeeding, are, so we use terms like chest feeding, when we are referring to trans men or non-binary folks. Instead of saying mother, we say parent, or father if they want to be called. So certain small things, can make nursing really dignified for trans persons. Similarly, as I mentioned, a lot of trans folks undergo gender affirmation surgeries. And you do have a set of specialized nursing care which is provided for people who are undergoing such gender affirmation procedures. And there's a lot of demand for such nursing talent. So yes, the answer is you do need some special care in certain special circumstances, but the universal principles of care and healthcare remain intact. Thank you. Any other questions? We'll be happy to take.
Thank you, ma'am.
Thank you, Dr. Aqsa, for being with us today. I need to ask one question. See, talking openly about your gender identity, it's very difficult. And in this society, you will face a lot of stigma and discrimination. So when you decided to open up in front of everybody, from where you got the courage and who is your inspiration?
Very difficult question to answer, but I'll say this, that for a lot of trans people, they don't really have a choice to remain in the closet. Since a lot of trans people may be expressing their gender, maybe having gestures or communication manners or body language which may give out their gender identity. If a lot of trans people do not have the choice of not coming out, that's one. Second is, in my particular case, for example, and I think it's also true for many other trans persons, is that this coming out is life-saving. Because when you are hiding your truth every day, when you are acting like someone that you are not, that takes a lot of toll on your mental health. And living your own life as you are can be extremely liberating, can be extremely peaceful. And therefore, in my case, for example, that coming out was basically a tool to survive. It was necessary. It was a survival matter for me. And that's what gave me courage, in spite of very strong opposition from my family. But I'm very fortunate that now my mother is extremely supportive and she's staying with me in Jamia Hamdard campus. So that gives me courage. And I think once you have crossed that threshold, once you have done that, and then you know that it wasn't really that difficult. Many times we are afraid of things that never come true. So I always say this to trans folks, that you have to judge whether you should come out or not, but ultimately take that leap of faith and do it if you want to.
Thank you so much.
Anyone else want to ask something? Hello, ma'am. I'm Dr. Belsi from Mental Health Nursing Specialty. And it was really an eye-opener for all of us, like listening to you, that the kind of challenges that you had been through. And I think today's session maybe really awaken the people like in the nursing field also. And we are also looking forward to help people and in empowering them and in helping them in the coming days. And I think there are a lot of things to explore also, because we ourselves are not knowing many of the terminologies and the issues that you are going through. So maybe we need a future collaboration and learning from each other. Thank you.
Definitely, and we look forward to that.
Yeah. Thank you, ma'am. Actually, every initiative of our department is always supported and encouraged by our eminent executive director and dean academics, Professor J. Chaturvedi. I thanks to them a lot. And the idea of celebrating the significance day was conceived by our principal, Professor Smriti Arora. Hearty thanks to you, ma'am, for making us aware of this day and bringing in people to talk about it. And in spite of her busy schedule, Dr. Aqsa was kind enough to consent to be the chief guest and deliver the talk on this day. Thank you, ma'am. I thank the Sangth group executives and functionaries for their presentation. It was an eye-opener, really, for us. And my heartfelt thanks to Ms. Raki Mishra for her support and timely help for conducting this webinar. I thank all the faculty, tutors, and the students for their time and presence. Special thanks to Ms. Manjeet for technical support. Sincere thanks to all the office staff and all those who supported the event. And thank you, participants, for making this event a success. Thank you, everyone. Thanks a lot. Yes, recording.
Hi, Bhakti. I think we can leave now.
You wanted to click a picture?
I think I clicked the picture.
Great. Okay,
Yeah,
fine.
good.
Let's.
Yeah, bye-bye.
Bye-bye.